Perfect. Everyone else, welcome to almost made it through the full day here. We are going to be talking about directories. So this is going to be an exciting one. If you thought that defining treatment was interesting, just wait till you hear about directories. No, maybe not quite the same level of excitement, but we've got some awesome panelists here who all use a variety of different directories, and I'll let them introduce themselves. Going down the line here and start off with a question in the introduction. So if you could introduce yourself and tell us how you define directory and what that means for your organization. Liz, you want to start us off?
Okay. Hi, I'm Liz Lewis, formerly Liz Buckle, same person. And I work for CommonWell Health Alliance. I've been here for a little over 5 years. Prior to that, I worked for an EHR company, which is also a founding member of CommonWell, and have been in the interoperability space the entire time I've been in healthcare. And a directory, the way that we've always described a directory, because it's funny, when I first started, we never called it that. I don't know why. But we have always sort of referred to our directory as a virtual table of contents and as a very visual learner, talking about something that I think to many, unless you're very technical, is somewhat abstract. That was easy for me to understand. So a virtual table of contents. I don't know how, we'll go deeper later, so I'll pass it.
Hi, everyone. Michael McCune. I'm a Director of Solutions Engineering at the Health Exchange. So yeah, directory, that's a big topic. I think at a very basic level, I think the directory gives you the ability to connect to other organizations, providers, et cetera. So that's the fundamental purpose that I see, but it's so much more than that. It's kind of a source of truth for so many things at our organization. It drives our dashboard, which allows our members to view all kinds of metadata about the transactions that are happening within our network, also with Carequality. It also drives, we're working on the rollout of a participant search map, so it actually drives that map as well, because you have all the provider organizations across the country that are on the Health Exchange on the map. And then another use is actually, it actually is used to configure our major gateway for our network. So our gateway obviously needs to know how to route requests, and the directory provides that information. So those are at least 3 uses. I'm not getting into specifics, but.
Yeah, and I'm Justin McMartin. I've spent the last 10 years at Surescripts working in our healthcare interoperability area. Working on things like clinical direct messaging, our record locator and exchange in the Carequality space, and then obviously been supporting some of the work we've been doing to stand up the Surescripts Health Information Network as a candidate QHIN. So my experience, and when I think about directories, it's really within the context of how Surescripts thinks about it, which is that directory is one of those kind of formal building blocks of interoperability that has to be there for us to be successful. And I like Liz's example of talking about it in terms of a table of contents. In a similar fashion, I kind of look at it as every single transaction and thing we do in healthcare is a story in and of itself. And when you think about the directory as the piece of the story, and when I say a story, I think who, what, when, where, how, why are we doing all of these things? And the directory really takes on the components of who and how us to be able to exchange those transactions. So I guess maybe I'm kind of calling back to some of the conversations Seth and some of the other folks up here earlier in the trust conversations were. So that is in a very high level nutshell, probably too abstract for a lot of people, how I think of what a directory is in the interoperability space.
Awesome, thank you. And I'm Alan Swenson, the Executive Director of Carequality. I don't have to tell you my thoughts about directories because I'm not a panelist. You can ask me all about directories. I've been debating all the good stuff about directories with Scott Stewie here for decades. No, maybe not decades, a long time. You can talk to him all about directories as well at the reception here shortly. I've got a beautiful picture though. This is straight out of the Carequality directory. Maybe not quite. Maybe it's a little simplified. But Justin, kind of building on what you were just talking about, and we'll go down the line to the extent everybody wants to provide additional context, can you explain how a directory actually works? And we pulled together a
Sure.
very simplified diagram of kind of what a directory looks like, or the types of organizations in a directory. How does a directory work, and what is the benefit of a directory to providers and your other end users?
Yeah, so kind of just playing off of my storyline topics, right? We're defining who first and foremost. And so I think when you think about the directory, the first aspect is then how do I actually get that information into it? And so we've got to have mechanisms and capabilities and ways of actually populating that information into it. I think we've heard through a number of the different presentations today some ways in which we're thinking about making improvements to that. There's been references to SOPs and all of those things that are tied to that. So that's really that first piece of it. So when you think about or take a look at this image up there, that directory is really populated by, in the Carequality space, those implementers. And then taking it from there, it's what else are you going to do with it? What is the how components of it? What can that directory and that information you do actually help to then enable the transactions and the information that's there? So whether it's a request for information across the Carequality framework, or if it's a request for information in another space, or it's a push message in the direct world to exchange information, we need a directory to enable and tell us that we can do those things that are hows in my space. And I think that kind of ties a lot to what Mike was saying in terms of the ways that they use it to configure the services that they offer from a network perspective.
Yeah, definitely. So yeah, just looking at this diagram, I mean, obviously you see hierarchy. So sometimes people compare directories to the phone book, but phone book's kind of one-dimensional, right? So the directory really has this hierarchy of, hey, here's this here's this high-level organization and implementer, and here's all the child entities underneath that implementer. Maybe there's HIEs in their own right below the implementer level, and then maybe there's providers, and you might even, not frequently, but you might even get down all the way to clinicians or something like that, but typically not that deep. But so you have a lot of richness in what you can convey in terms of hierarchy. One interesting thing I think the rule about the Carequality directory would be, you can only connect to an entry that has endpoints, right? So if you have endpoints to connect to, that's considered like a node or a system that you can connect to. Not everybody in the directory has a system or a node. Maybe you're a hospital and you have access to an EHR, but you don't actually, host or maintain that EHR. So, but a lot of that is conveyed in the directory. You say, oh, I see that this hospital's listed, but they don't have endpoints, so they must not, manage that system. But above the hospital is a hospital system entry, and they have the EHR system. So so there's a lot conveyed there. Mining all that data, it can be pretty tricky, to have to figure out where are you in the hierarchy. Do I need to go up the directory to query that system because this organization doesn't have a system. So yeah.
Yeah, I would add to that. I mean, there's not a lot to add, I guess, to those particular components, but the way that we use the directory today, and we have, as Alan mentioned, we have our own network directory, and then we connect to what we call our external frameworks, our external directories. And there's certainly a lot that goes into integrating 3 into 1 kind of master directory that we're able to leverage, and how we interact with those differently. And the data that's contained within the entries is critical to being able to interact in a meaningful way. And ultimately the goal is, can I figure out where to go to get the data? Like if we don't have a strong foundation, which I see the directory and the way we integrate directories into the one that we use or the one that you use, to be able to figure out, based on whatever technology we're using, whether it be a record locator or not, like how do we know where to go? Because if you have, I was looking at some of our numbers, and between all of the entries that within our universe, including Carequality, including TEFCA, there's like over 70,000 entries. And to Mike's point, not all of them have endpoints, which is true, but still, that's a lot to weed through. If you think about a table of contents does have a hierarchy, but that would be pages and pages and pages long in a Word document even. So, thinking about it visually like that, I think some of the benefits that we've begun to see, to providers. You think about Carequality now is 10 years old, right? So you think about just the benefits of having a directory, despite the good, the bad, and the ugly of any sort of directory, because none of them are perfect, is the ability to reduce the point-to-point connectivity that ruled the world and still persists today, and there's still going to continue to be reasons for point-to-point connectivity, but it has significantly reduced the burden, which does stem down to the provider organization financially, and also in just contracting with who are my trade partners. You may have a list of trade partners, but then you probably have patients who seek care outside of your traditional trade partner home, and having quality information and being able to leverage a directory's data is really critical to being able to solve for that. And one other thing I think is really cool is, everything we do right now is query-based, but the directory has a capacity to do even more. And so we actually tested over the course of the past couple of months with Epic, leveraging our directories to be able to do Fire Exchange and putting Fire endpoints in those directories. And, Fire right now, I think, is in a very point-to-point state, with a lot of, one-off handshakes and negotiations. And I think Fire is great. But again, if I don't know where to go, I don't know what I don't know, right? And I can't build all these connections myself. That's ridiculous. So I think there's a lot of potential, and so a lot of growth.
Yeah, well, I just want to play off of that, and maybe try to just spin what you're saying, I think, in a way that hopefully resonates for folks. Is we've heard several times throughout the last couple of days, all of the sessions today so far.
One day.
Yeah, I've only been here a day. I know some of you have been here longer. But is the scalability aspects of it, is for folks like the three of us sitting here right now, to do this in a meaningful way across the country, and to do it in a way that is going to be successful at all, requires us all to engage and do it in a meaningful way with a directory. Because if we're out there guessing and trying to figure out the best ways of looking for information or finding how to connect to those organizations, we're never going to be successful in really creating that type of environment. And so I think, as you look at all of our networks and the things that probably all of you are also doing when you think about your directories and otherwise, is without it, I just can't do this in a meaningful way. Because otherwise it is just it's point to point, every setup, every contract, all of those types of things that come into it, just gets very, very difficult to do when we think about how complex our healthcare system is, especially.
So I want to push on something that you've all kind of touched on, and that is that you all have your own individual directories. Those directories are made up of other directories, right? CommonWell pulling in from different places, and eHealth Exchange is pulling in from different places. Surescripts also has, direct messaging and other things as well. So there are all these different directories out there. What does that take when you're looking at your directory and pulling in these directories from other places? And there's this idea that has been debated of should there be, a single directory that has everything, we'll call it the one directory to rule them all, or, maybe there's a federation of directories or some other alternative. Like what does it take today with the directories you're working with, and what's kind of the ideal state of how directories could work in your mind?
Who's going first? You want to rock, paper, scissors?
Yeah, right. I was going to say. I mean, I'm happy to jump in. I think, this is obviously a core challenge with everybody. It's not just the network side of this. It's like, you hear this in the States. I think there's programs going on in Oklahoma and otherwise. You hear it at health plans. You hear it at the healthcare providers. How do I create these environments where I understand who it is that I'm working with and the whys and the hows around how I actually work with them, right? These are challenges regardless of network interoperability. And I think really the way or the perspective that I will bring to it to say what Surescripts has done is to say, we have kind of our core tenet of what our directory is, of what is our network and how do we serve our customers. And that is where we start. And then as we continue to work with new organizations or with all of the different groups we talk about, the Direct Trust Directory, the Carequality Directory, soon, in the future here, working with the TEFCA Directory. As we do all of that, we say, how can we pull in the right aspects of each of those components of the directory, do it in a way that meets those core tenets of the way we approach our directory for our customers and our partners, and do it in a way that's safe and effective and trustworthy for them so that we can expand the way that we're using our network. So that's a really nebulous answer at a very high level, but I think that's where we start. So kind of a principle side of it. And I'll see how you all think about it.
Yeah, I have sort of opposing feelings about it. One, because interacting with a number of directories is challenging. The structure is different. Trying to combine multiple into one that's meaningful, like you said, to your end users, and figuring out what goes what and what's synonymous between directories is difficult. And so I think that there's this idea that having one single directory solves all. I can't see anything up here, but I did want to say one thing and call out Dee Dee, and who isn't in this particular role, but always says garbage in, garbage out. And I sort of feel like we need to come to some agreement on what would this single directory even look like, and what is its purpose, and who is it serving? I mean, before, we are still having debates in the TEFCA directory space, and I feel like we've made some progress from, we're learning as we go, but I think there's still a ways to go before we feel like this could be the foundation for the one. So that's where I'm saying I feel a little opposing views of, doing these multiple integrations. I think also about, when we get into vetting, and we've been talking about vetting in some of the unconference sessions, there's additional details that need to be pulled in outside of what we do today. There are other directories that exist, CMS directories, NPES, and how do we integrate those? Should we integrate those? Which ones are quote unquote good sources of truth? Which ones haven't been updated in a while? I mean, there's so many layers of complexity to it that I think we should be really thoughtful and intentional, but I think there are opportunities to expand, a source of truth that a community like this feels comfortable with.
Yeah, I can say from firsthand experience, merging multiple network directories is no easy feat, right? I mean, when you try to merge two different directories that may not even be on the same technologies, and you're trying to look for duplication of entries. Do I have the same organization in both directories? Some people have proposed, directories can kind of be a way to weed out duplicate data, but I don't think you really ever get there just with the directory alone. But it comes really from the requester ultimately having to unfortunately weed out some of that duplication. The directories at a macro level can help you weed out duplication from not having the same organization listed twice, or at least you're aware that the organization is listed twice. But yeah, I can say that merging directories, I'm not sure we'll ever be able to do that in a very easy fashion so that you have a single national directory or something like that. It would be very nice, though, if we could get all the national network players, if you will, to all have the same directory, have fundamentally the same directory structure and some of the same content. And we've kind of done that in a way a little bit, at least with between Carequality, eHealth Exchange, and TEFCA. We do all have fundamentally a very similar base implementation, FHIR implementation guide, as they call it. So we have the same basic content. We diverge, of course, for each network's needs. But yeah, so that is a nice, I don't know if that was, I guess that was done intentionally to some degree. And everybody seems to be playing pretty well with that. I don't know if we're going to diverge more, but if we do, it gets harder and harder to provide some kind of single unified directory. So we have to watch about that divergence, as we go forward and saying this, maybe TEFCA says we need something completely different. And if they do, that diverges from the other national network players out there.
Yeah, Alan and I were just having a conversation last week about sort of the two differences, and I had an issue with how do I handle this entry that I need to put in Carequality and in TEFCA, and the processes are different, and I don't have a good solution for how to do this cleanly, right? And so eventually we'll catch up and they'll be in sync with each other, but the divergence is certainly challenging, both on the consumption side and on the publishing side as well.
I just wanted to note that Mike was going much more for the United Federations of Planets directory versus
Which
the one directory.
I'm not qualified to speak on that, so I'll exit.
Sorry. No Star Trek fans. Got it.
Trekkies out there.
Yeah.
Yeah, and Liz, to the concern you were raising, it's bringing in and merging multiple directories you talked about, but then when you have one directory that you need to populate multiple directories from, that's what has led to some of the issues. When you're pulling it in and just have to deal with it yourself of how do I deduplicate this, how do I merge these things together, how I want to show it. But when you have one thing that needs to go multiple places and that thing needs to be published differently multiple places, that can certainly lead to other issues.
Yeah, absolutely. Yeah. I just wanted to add too, in the concept of like, what are we showing? What do we pull in? I mean, the directory is all this glob of information, and then we as a implementer, as a QHIN, whatever we are, have to figure out like, what are we providing back to our users to be able to see from that, because I'm assuming we're not just like dumping the entire thing. That's a bit much, and it's been really interesting to see some of the new like information that's being shared, and I think we've had conversations in Carequality about what sort of information from the directory should we share even beyond just the implementer community to see. One of the things that we've been looking at is and have been increasing transparency for our members is about who's able to respond to what, because I don't want to just blast people with queries if they're not going to respond, and so we have to have be able to fine tune our technology a little bit better to go, okay, you have an endpoint and you can respond to X, or if you can't respond to X, I'm going to exclude you from sending you an XCPD because that doesn't make any sense. And I'd love to also see the opposite of that. So what am I qualified to initiate queries for? Because we capture that now, and that has been so important to differentiate between what am I qualified to initiate queries for and what will I respond to. With us, you have to go through a certification process, you have to provide evidence, you have to provide a workflow. Like there's there's always room for improvement, but there's a certain level of rigor to be able to initiate a query for something. And I'd love to see sort of an increase in transparency, at least at the implementer QHIN level, around what are you saying that you're qualified to? Because I think we also want to talk a little bit about first line of defense and what does that mean, right?
Yeah, I think that's great. If we go back a slide, if I can push the right button. I mean, the title of the session here is Directories as First Line of Defense. So, I mean, obviously, you talked a little bit about some of the vetting process, some of the information in the directory, but like, what does that mean, that the directory is the first line of defense?
I mean, I'll jump in and just say it's exactly what Liz just said. It is the first line of defense because it's that visualization of what the heck this thing actually is that I'm working with, right? And, you know, going back to my who component of it, I get to see who it is that I'm either interacting with in terms of who I'm requesting to or initiating a request to, or I can see who that request is coming from. And those things are just absolutely critical from the trust aspects of all of the things Dr. Eisenberg and Dr. Blair and Seth and folks were up here talking about earlier today, is that transparency aspect of it. And so I think when you say it's the first line of defense, it's because it's that most obvious thing to so many of the people who interact with it. I think to call back to your question earlier that I think I ignored and just didn't answer, Alan, around like benefits to a user, right? This is what it is. It is really that ability for somebody to have that understanding of what's happening under the hood, because so much of what happens in you know, network interoperability, and I think, again, several people referenced this today, it all happens in an automated fashion and in a way that a lot of people don't have any real visibility to it. And so when you can go out to the Carequality website and put in a location and search and see, oh, here are the folks who are connected in my community, it gives you trust and understanding of what it is we're actually interacting with and how we're working together.
Yeah, definitely. I would say directory is all about transparency a lot, right? You know, who, especially to somebody new to our network, or you know, they want to say like, hey, what are the providers that might query me? You know, who's out there? And of course, you know, identifying who they should query as well, obviously. So, you know, without the directory, it's, you know, it's not probably good enough to just say like, I want to connect to implementer XYZ. You know, you want that name recognition of what's that hospital name, what's that doc office name, all that kind of thing. So definitely that leads to transparency. Also on the Ethics Exchange, I know we engage in what we call reciprocity investigations. So we're interested in seeing, like, you know, if a provider is initiating and querying for treatment, are they also sharing data back? So, you know, we regularly monitor, you know, check that, monitor that, and conduct that type of investigation to make sure that there's, you know, kind of quote unquote fair play on our network. So.
Yeah, when I was thinking about this question, I just wrote like trust in all caps in my notes. Because I think we're living in an environment today where it's not the same as it was several years ago. You know, and I think that in order to continue along the path that I think most of us want to continue along, which is increasing scale and availability of access to data for providers and patients and other Ps, that we have to take a really hard look at the directories. So I know we've implemented pre-directory processes that didn't exist several years ago, and I know others have done the same. And you know, everyone's kind of doing that a little bit differently. We have a new vetting process for a specific type of exchange, but there's all sorts of other types of exchange that are happening in what I call like intra-network with external partners, et cetera, that, you know, also come into play and may not have a very clearly defined, you know, requirements path to get to saying yes, but still need to go through some level of, you know, interrogation and vetting before they can go in. So what I think about from a trust and defense perspective is getting access to something like eHealth Exchange or Carequality or TEFCA. You know, getting access to that directory makes you in. You're in now. And once you're in, you have a lot of power, and you can do good things and you can do not good things. And it's up to us collectively, and especially implementers, to take that really seriously and think about, you know, who holds that power and what are they doing with it, and do continual checks, like Mike said, on, you know, are you sharing data back is a huge one as well. to look for. What is the name of this organization? And kind of combing through that and seeing what's out there is super important.
I want to go back to your garbage in, garbage out comment, because I think, our discussion of it is trust, it's that visualization. In the same way, it can be distrustful and a thing that we don't believe in if the information is wrong too. And so it goes both ways in any of those scenarios. So just wanted to call that out. We're thinking of it all from the how do I use it for good and in the best way possible. But also, as soon as you have the inaccurate information, otherwise, then we're decreasing trust in that process at the same time. And so I think it's really critical that the maintenance aspects and all of those types of things come into play whenever we're talking about this as well.
Yeah, not everything that has to do with garbage in a directory is, nefarious, bad actor stuff too. We had an implementer on our side who had an automated technology to place their organizations into our directory. And if a particular data field didn't exist on their side, they put some bogus data in, and this was 10 years ago. So 9 years ago, I don't know the exact day when this started, but and then probably whoever made that decision left the company.
It was 100% at an IHE Connectathon, and some developer was
That's what I'm saying.
Let's just put this in, right?
That's exactly what happened. And then that person went off and did something else, probably left the organization. That knowledge died with them, and no one knew that was even happening. And then we go in and we're like, what is this? Why? This doesn't even make sense. I know they're smarter than this. So it's not all I'm so afraid of all these bad people trying to get, it does exist too. But I think there's also, let's be very clear here, there are people who manually type things into a system, into a UI that goes into, the Carequality directory through their implementer. And there are systems that use APIs and where the data, again, garbage in, we have to make sure that where these systems are pulling data from, that we're doing validation checks on that as well before we populate. There's a lot of layering that goes into the success of a directory and the cleanliness of a directory. And we didn't even talk about geolocating. If you have garbage in there, you're never going to find what you need. So there's a lot of that.
Well, so tell us a little bit about that. I know my geofencing is definitely something that eHealth Exchange talks about a lot. I know everybody here does something with how you actually utilize the directory, whether you're doing something based on states or some sort of zip code radius or something like that. What does that look like for how you actually utilize the directory and needing to have that clean information? What's the impact there?
Yeah, it's critical to have, good directory data for provider locations, because that's what drives a lot of geofencing, obviously. So, we have a variety of different ways we do geofencing. We've got a state-based approach, which is very sort of macro level. And so we actually have in the directory published you can publish at our participant level, kind of high level, what's the states of operation of this entity. And of course, each provider is also listed as being a member of that participant. So, that's critical that we have valid states of operation for everybody in the directory, or else that's garbage. If we get that wrong, and the geofencing will be garbage. And we have a similar thing that we do with Dartmouth hospital referral regions, another type of geofencing that's based on that. So again, same concept. If that's mostly driven off the zip code of the providers, so if the zip code's off or something like that, we get the wrong hospital referral region, and then we're accruing the wrong set of providers or HIEs. So,
Yeah, well, and I think when you really think about geofencing, I think it's worth tying it back to what are the benefits to a user, and what, how does this play out? And it goes back to my comments from earlier about we need these directories to be able to do this in any way, so that at the end of the day, when a provider is sitting in their office and they're going to see a patient, they can rely on the fact that we found them the right information. And that ties back to geofencing and otherwise to make sure that we can find that patient at those other locations in effective ways. And so if we don't have the right data to be able to support that type of exchange in the way that we're supporting it, we're not going to find them, and we're not going to be able to return the right information for providers or whomever else at that point. So I think that really ties back to more of the how do we make this all happen using directories and do it in a way that's meaningful to users.
Yeah, I'll add kind of one main point, I think, to this. I have sort of strong opinions on geofencing, but I think, I'll probably just set that to the side. I think, the fact is that it exists, and one of the things that is, I think, I don't know if others have really contemplated this or feel like they have great solutions to it, but if you think about like a large health system that maybe spans multiple states and has like one headquarter location and has one gateway that is the endpoint in the directory, and as Mike was saying, you have to kind of traverse the directory to figure out, do I go up to this larger entity and gateway because that's what exists, or do I go down? Where do I go? I think what is really critical and almost should be like a requirement, I don't know, I don't want to make it a requirement, but is
all right, we're writing policy.
We're writing.
Get ready, get your pens out.
Alan is like, oh, this is in my inbox again, get out of here. No, but I think having facility level information with locations where care happens is critical. Yep. So think about, you all can probably like do a little imagination in your mind. Think about a health care provider that is in all 50 states, and maybe in the room here today, that connects to eHealth Exchange and CommonWell. And think about the fact that, maybe they have one gateway, and that, could be in Washington, D.C., and they have facilities in every state, multiple facilities in every state. And how do we find the data for people who we really, really care about, who defended our country? So this is hard stuff, right? And so having really good detailed information and being able to figure out how to traverse up and down as necessary is so critical to being able to find the information that you need for your patient in, right time, right place, right data.
Mm-hmm. Well, building off that, I see we got the sign. We were down to like 4 minutes left. So last question here. We'll go down the line. What is your best practice recommendation for, really everybody in the room interacts with directories, whether they're directly doing it or not, whether they are consumer or providing information. What is the one thing you would say is a best practice that everyone here should know and be thinking about when interacting with directories?
This way.
Go for it.
So I think that, I'm going to be a little off maybe, you guys can, but I think that the best practice is, if you're an implementer or you interact with the directory in some way, shape, or form, is learn about it. Talk to whoever operates that directory and learn how it works. Because I can tell you from experience, I have interacted with the directory and I didn't have the knowledge that I should have had, right? Hindsight 2020. But educate yourself on how it works so that you can assist in making it better, so that you can make sure that the data you're putting into it is good quality data so that it can be used effectively. So educate yourself on the directory itself, would be mine.
Yeah, I would say quite simply, keep the directory updated. It's got to be constantly reviewed, vetted, and updated. I think it's easy to let things go stale, and maybe someone doesn't update it for a year, 2 years, something like that. But that's probably stale data at that point. So that's my single biggest takeaway is just keep it updated.
Yeah. I'm going to agree. I'll call it good data hygiene practices, right? It's not just updating, it's reviewing it on a consistent basis. It's having some way to make sure that it is coming back to the top of your mind every so often. And I mean, just as an example, some things that we've historically done is we have automated processes to essentially trigger that for some of our partners to say, hey, you haven't updated this in so long. We're going to turn it off and see what happens, right? And I'm not saying that that's a nice thing or a thing that we love to do, but at the end of the day, if we know people are not looking at this, we know that things are going to be wrong, and we want to try to prevent that. And there are many people in this room who probably hate the fact that we do that, and I'll probably hear about it afterwards, and that's fine. But I think it's just a necessary thing for everybody to do when we're thinking about things like directories.
Awesome. Well, with that, anybody who does hate it can talk to Justin at the reception here in about an hour. So we're going to close things up here. Thank you to Justin, Mike, and Liz, our panel, for talking to us about directories today. Hope you all learned something new. And we'll have a QHIN game show here shortly, and then get on to our reception. So thank you, panel.
Thank you.
Thank you.